Welcome to Medical Minutes here on Time Warner Cable DMG TV2. I'm Jennifer Clark. This edition of Medical Minutes is all about breast cancer because October is Breast Cancer Awareness Month. Our first guest today is Dr. Walter Randolph. He is an OBGYN here in New Philadelphia. Welcome to the show.
Thank you for having me.
And because you're the primary care women's doctor, you do a lot of screening for breast cancer. Every patient gets some kind of clinical exam, don't they?
Absolutely, absolutely. Just as important as having their pap smears, having their breast exams and getting started with screening.
And how often do women have breast cancer? It's somebody that you know has breast cancer.
More than likely, and it's very common. The risk is about 1 in 8. You hear that quoted quite often, and so most
1
women,
in every 8 women has breast cancer,
correct,
or will.
Correct.
That's
and that's
a lot.
lifetime now.
That's a lot.
It is a lot. It is a lot. It's one of our higher risk cancers, and if you haven't known somebody directly, you may at some point in time.
And cancer, everybody thinks, I'm going to die because it's cancer. But breast cancer is treatable the earlier you get it or
Correct.
catch it.
Absolutely. We see a decrease in the cancer death rate over the last 20 years for breast cancer because we're finding things earlier. The earlier we find it, the better we can treat it. So I think more women are seeing people that have breast cancer and they think there's more of it. It's just more people are living with it.
Is a clinical exam by your OBGYN good enough once a year?
No, it's a big part of the exam and a big part of screening, but we know that what you can see is something that's smaller than what you can feel. So even though we do the exam, you need to have a mammogram.
And the mammogram, some women don't like that because it's invasive and pinching and you don't want to do it.
It is.
But it's necessary.
It is necessary. As I said before, the feeling is that we can actually see something about 3 years before you can actually feel it. So having the mammogram gives us that head start or jump start on treatment. And it can be uncomfortable. Every woman is different. Some women, timing is everything. So if they haven't gone through menopause, working around their cycles might make it more comfortable, backing off on caffeine, trying to do some things to make it a little better for them.
And when should you start getting mammograms?
We recommend starting at 40. There are several recommendations out there, but in general, the recommendation is start at 40 and then come yearly after that.
So an annual mammogram, an annual clinical exam by your physician, but you yourself, self-breast exams are just as important. Absolutely.
Women know their bodies and they know what they feel, and if they're familiar with their breasts, many times they can find things before we do, because they check it once a month. So yes, very important.
And most breast cancers found in the shower?
Most women check in the shower, so most breast cancers are found there. The soap and the water help pick up your sensitivity, and so it's a great place to check.
Is it too late then?
No.
Once you feel one?
It's never too late. It's never too late. The only wrong way to do an exam is to not do an exam. So don't think that once you find something that it's the end of the world.
And when you're trying to talk about this, some women, they don't even want to talk about it. They don't want to do the self-exams. They don't want to come to the mammograms. They don't want. How do you convince your patients that they need to follow these guidelines?
Well, and that's the problem. They are guidelines. They are recommendations. Obviously, I can't handcuff them, drag them over, and have them have a mammogram done. Try and explain to them that if you find things earlier, that it's more treatable. And try and take the fear away. I think there is a fear that
anytime you say cancer, someone's going to be afraid.
Absolutely, absolutely, and they're afraid that if you find something like you said before, that it just means that they're going to die from the disease, when the vast majority of women don't. So we try and take the fear out of it. Don't be afraid to come in. You can't just put your head in the sand and hope that it'll go away.
It's not going away.
Right. Right. So find it early and you will do better. Hopefully they never find anything.
And as far as the guidelines go, they've been changing and evolving over the years. When you first started doing mammograms, I don't know when that was, 60s, 1960s, 1970s, you only did it after they found a lump.
Right.
And then it's too late.
Then not always too late, but it's much harder to treat. So we have found that doing them earlier makes a big difference. In the beginning, you're right, it was only done if you had a problem. Now we do them ahead of time. You can't do them on everybody at every age, so it has to make sense when you do the mammogram. That's why we wait till you're 40. No, you just have to keep getting your mammograms done, I guess.
Well, and the other controversy was the self-exams, because they didn't want you to do a self-exam. They want you to only a doctor can find it.
When they looked at the numbers and said that you find things with mammograms before self-exams, they said, well, don't do self-exams because it just creates anxiety and it just gets women worried, and then they have unnecessary testing done. And I think that's a bad way to look at it. And everybody, after looking back at that recommendation, said that's not a good message we want to send to women. So do the self-exam because it puts the power in your hands. You know your body better than we do.
And then what about the false positives? What does that mean, a false positive?
Well, there's no such thing as a perfect test. And so every test out there has a certain number of false positives where you think you see something there, but it's really not a problem. And then there's false negatives where you do the exam and it's negative, you don't see anything, but there's actually a problem there. There is no perfect test, so we have to take that into account.
So I don't want to be the one where the mistake is made. How do you avoid that?
Well, first of all, on the false negative side, you do the exams yearly so that it doesn't have time to grow. So if you're waiting every 5 years and you missed at one exam, the next time you come in, it can be a big deal. So you do them yearly. From the false positive rate, it has a lot to do with how each woman's breast is built, really. And there are sometimes when they think they see a mass, you come in, you have a second test done, and many times there's nothing there. We're not trying to scare women, we're just trying not to miss something.
So it's better to be safe and go and have two.
Exactly.
And make sure that there is nothing
Exactly.
there.
So women need to realize that if they're told to come back for an extra view or an extra test, it doesn't mean that there's a problem there. It just means they're concerned and they want to make sure that there's nothing they have to look closer at.
Well, with 1 in 8 women having breast cancer, I would imagine some of them coming back for the second is also to confirm that they did see something.
That's correct. And there are times when you come back for a second view, they see what they thought they saw in the first place, and then there may be more screening or testing that goes beyond that. Ultrasounds, MRIs, biopsies, and those have improved to where it doesn't always mean surgery to diagnose. And some women are able to do a small biopsy if there's nothing, if there's no problem, at least they don't have a large scar, they haven't had to undergo a large surgery. So we're trying to be better about that instead of doing open biopsies on everybody.
And did you find your patients follow what you tell them?
I hope they do. You know, we always hope
If
that
they
when
come
they come
back every year.
follow, they keep coming back. And I think if we've sat down and had a good conversation about it, patients are much more willing to keep going with it. There are patients that I have and that everybody will have who are just, they don't want to do a mammogram, or they don't even want us to check them. I can't force them to do that, and I pray that nothing ever comes up, but you know, in general, women do follow the guidelines, and they may hate it, but at least we're keeping them safer, we hope.
All right, so self-exam every month. Go see your OBGYN every year for pap smears and clinical breast exam.
Right, whoever
and
your
a mammogram every year.
Correct. Whoever your primary care provider is should be doing a breast exam for you and scheduling a mammogram. And the rest is in your hands, literally.
All right, well, hopefully we'll reduce that 1 in 8.
I hope we do. I hope we do.
Dr. Walter Randolph, he is an OBGYN specialist here in New Philadelphia on DMG TV2's Medical Minutes. I'm Jennifer Clark.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
Hi, I'm Scott Robinson. Join me this fall on TV2 Sports for exciting high school football action featuring the Dover Tornadoes and the New Philadelphia Quakers. There will be replays 3 times. On Friday nights, on Saturdays, and on Mondays. For the best in exciting high school football action, check out TV2 Sports this fall.
Welcome back to Time Warner Cable DMG TV2's Medical Minutes. I'm Jennifer Clark, and this time around we have Dr. Greg Boone. He is a surgeon with Mercy Medical Center, and we are talking about breast cancer. October is Breast Cancer Awareness Month, and there's so many women that have breast cancer or know someone. It touches so many lives. But what can you do about it? As a surgeon, every breast cancer patient needs some kind of surgery, right?
Yes, for the most part. Surgery tends to be the primary treatment for most breast cancers. And you know, the really good news is that our success rate in curing breast cancer has just really blossomed in the last 10 to 20 years. Most women do need some form of surgery as an initial treatment to control the disease locally in the breast. That's one of the roles the surgeon plays. And perhaps as important a role is to gather information that helps the other team members that treat breast cancer to make good decisions and give good advice to patients about what other treatments above and beyond surgery that they might need. So the treatment of breast cancer is not one doctor, it's really a team approach. There are surgeons involved, the primary care physicians who frequently are the initial folks who make the diagnosis or at least find the lumps or the abnormalities on mammogram that lead to the diagnosis. We have radiation oncologists that are frequently involved, our medical oncologists who use chemotherapies and other drugs, some that block hormone effects and things like that to help treat the breast cancer. So it's a real team approach.
And there are different types of surgery. I mean, complete total mastectomy versus just removing a very small tumor.
Yeah, I think in general the two mainstays of the surgical treatment of breast cancer are mastectomy or removal of the breast, which 25, 30 years ago was much more common than it is today because a lot of women are diagnosed at earlier stage, meaning they have smaller tumors, and a lot of those women don't need to have the breast removed, so they can have a lesser operation and preserve the breast, which of course cosmetically is a huge advantage. The commonest term that gets used for that is lumpectomy, meaning that you would take the entire cancer out with some normal tissue surrounding the cancer.
And then some women have preventive surgery and they think, you know, my mom had breast cancer, I don't want to do that to my kids, I'm going to have a mastectomy.
Well, yes, that's true. That happens sometimes, and of course that's been in the news a lot lately because of Angelina Jolie and finding out that she carried a gene that predisposes to breast cancer. Most breast cancers are not genetically caused, or at least we haven't identified a particular gene that causes them. It's only about 5% of breast cancers today that we can identify one of these genes, the BRCA1 and BRCA2 genes being the commonest, that we know are associated with a high risk of breast cancer. Clearly, if you carry one of those genes, doing prophylactic mastectomy, meaning removing the breast when there really isn't a cancer there, a healthy breast, can make a difference in your life expectancy. The truth is outside of that particular situation, removing the breast prophylactically, if there's not one of these genes involved, probably doesn't change your life expectancy. It does decrease your risk for developing breast cancer. So there are some women who are diagnosed with a breast cancer on one side who opt to have bilateral mastectomies to prevent that problem on the other side, and it does prevent the disease pretty effectively. But we probably don't change that person's life expectancy by doing that.
And in your practice, is it more the lumpectomies that most people go to? I mean, you said we catch them earlier these days, so it seems that that's more common then.
Yeah, I think it has probably become more common, and that's because, of course, 25 or 30 years ago, it wasn't very common, so over time it's become more common. But I really, frankly, think it's a very individualized decision. And you know, one of my most important jobs has nothing to do with what I do in the operating room. It's what I do before the operating room, and that is give the patients the knowledge they need to make a good decision based on knowledge and not on fear. And so,
how do you control that? I mean, any woman who's facing breast cancer is filled with fear.
Well, it's a very difficult thing, and any cancer is filled with fear, and I'm a cancer survivor, so I personally know what that fear is like. But knowledge is power, and if you can gain that knowledge, and it takes time, and it takes a team of people to give you the knowledge that you need to make those good decisions and to make them based on that knowledge and, again, not on fear. A lot of women come in and think they already know what they want to do because their gut reaction to having cancer is get rid of it, take my breast off. But once they learn more, sometimes they change their minds and sometimes they don't. And the truth is for women who have smaller tumors, whether they choose to have mastectomy or whether they choose to have a lumpectomy, which is most frequently combined with radiation treatment to the remaining breast, no matter which they choose, it's a good decision because under the appropriate circumstances, they're equal in regards to long-term survival. So once patients learn that, then they can make a decision, again, based on knowledge, not on fear.
And you mentioned earlier that it is a team approach, that the whole medical team works together. So even as a surgeon, you can kind of weigh in on who's a candidate for chemotherapy and radiation.
Well, certainly I weigh in on that sometimes because my patients will frequently ask my opinion about things. What I do, I think more importantly, is I gather information from what I do at the time of surgery that helps to guide the advice that the oncologists would give regarding chemotherapies or hormonal therapies and or radiation therapy. So learning about things like the exact size of the tumor, learning things that they do, special testing on the tumor to look for things called receptors, where we can learn whether hormones like estrogen or progesterone might impact the growth of the tumor, and manipulating those by giving pills like tamoxifen or some of the newer versions of these drugs that block the estrogen effects, whether those will be beneficial. We learn that from taking that tumor out and doing testing on it, which of course our pathologists, another member of the team, very important member of the team, help us by studying the tumor and giving us that knowledge that helps to guide our treatment recommendations. We find out about the lymph glands underneath the arm, whether there's tumor involved with the lymph glands, and that helps to guide some of the treatment recommendations.
Now, you seem so passionate about treating breast cancer. You are a member of the Susan G. Komen of Northeast Ohio. You're on their board of directors?
Yeah, that's right. Yeah, I guess I'm passionate about cancer care in general, but for my...
That's the Live Strong shirt you're wearing right now.
That's correct. I'm also involved with the Live Strong Foundation. Yeah, I think my real true connection to cancer came from my patients. I've been doing this for 24 years now, and always had a special interest in breast cancer, so I've taken care of a whole lot of ladies through the years with breast cancer, and some men as well, of course. And so that's where my real passion in battling cancer, I suppose, came from. And then 13 years ago, I was diagnosed with prostate cancer, and so my own personal experience certainly had an impact as well. So being involved nationally with an organization like the Live Strong Foundation, there's an organization that provides one-on-one cancer support based in Chicago called Emmerman Angels that I'm involved with as a medical advisory board member. And then here more recently being involved pretty heavily with the Susan G. Komen Foundation of Northeast Ohio as a member of their board. It's all important things to do and to try to make an impact.
Well, it sounds like you are, and you've already given us some good information about the surgical options that women with breast cancer will have. Dr. Greg Boone, he's a surgeon with the Mercy Medical Center. Thanks for being on Medical Minutes here on Time Warner Cable, DMG TV2.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all of your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more, Ember Complete Care serves all of Tuscarawas, Coshocton, and Harrison counties. Call 800-462-0909. Ember Complete Care. It's good to be home. Looking for ways to get a return on your marketing investment? Get results with Digital Marketing Group. We provide a digital marketing solution with state-of-the-art opportunities to increase your visibility in the community, optimize your digital presence, and maximize your marketing investment. We specialize in affordable websites, custom mobile apps, search engine and social media optimization, high-definition video production, broadcast television. If it's digital, we develop it. If you're looking for a way to increase your profitability, obtain new customers, retain current customers, and get the return on your marketing investment, then go digital. Get results with Digital Marketing Group.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
Welcome back to Medical Minutes here on Time Warner Cable, DMG TV2. I'm Jennifer Clark, and with us this time around is Diane Wofsy. She is the nurse navigator at Mercy Medical Center, and we call you a navigator, but you really specialize in breast cancer. And what do you navigate patients through?
Just about everything. I initially meet patients when they come in for their breast biopsy. Although sometimes I meet them ahead of time if they've called me with questions pertaining to an abnormal mammogram. But I'm kind of that person that shows up every step of the way. I see them when they first have their biopsy, like I mentioned. I also see them again once they have the biopsy. So I'm that constant person that they keep seeing.
Because you know the whole story.
Yes. In addition to whoever their surgeon is, they can contact me with questions If I feel it's something that's beyond what I can answer, I get a hold of their surgeon, tell them what's going on so that the patient and they can touch base. Once the biopsy is done and we know if we're dealing with a breast cancer, then when the patient comes in for their pre-testing visit prior to their surgery, I meet with them again, and we have an entire class that they participate in. And it prepares them for what's going to be coming down the road. We talk about drain care. We talk about what the day is going to be like the day of surgery, what is going to happen to prepare them for their surgery.
I'm sure they have more questions than they can get in that small session.
But the sessions actually aren't that small. I have been known to spend anywhere from an hour with someone to as much as 3 hours, depending on how many questions they have and what their needs are. So it can be short or it can be as long as the patient needs. They don't leave there.
And that's one-on-one? Do you also have groups?
It depends on how many patients are scheduled that day. A lot of times it's one-on-one with me. But there are times when I may have 3 or 4 women all scheduled in the same afternoon, and so then it's done as a group class. And at first I wasn't sure how that would be received, but I soon quickly found out that there's a bond that forms with these patients, and they quickly become very comfortable being in the room with another newly diagnosed breast cancer patient. So it ended up being almost comforting for them in a way to have somebody else there.
And then there are support groups,
yes,
which are different from navigating.
Yes. I facilitate a support group the second Monday of each month at 6:30 in the evening. It's held in our resource library, which is located in our cancer center. If they came, they would enter through the surgical center side of our hospital. But it's the second Monday of each month, 6:30 in the evening. Any breast cancer survivor can come and participate. So you don't have to be a Mercy Medical Center patient in order to come and participate. You don't have to call ahead of time to say you're coming. You can just come and join us.
And some just listen and some actually just want to talk.
Yes. Some listen.
What do they tell you?
Everything and anything. It's pretty much a no-hold bar that night. Because they're there with women who have been down this road. They share everything and anything. And it's every age group. I have some that come that are in their 30s all the way up into their 70s. I have ladies there that are 25 and 30 years out from their breast cancer diagnosis, and I have ladies that were just diagnosed a few weeks ago that come.
And I imagine that you look at them all the same, because some people, oh, well, your cancer was only, a 2-centimeter tumor and they took it out and you're fine. Well, this woman over here had a full mastectomy. So they're all the same, aren't they?
Not necessarily, because they all bring, I guess, a different set of needs and sometimes different issues to the table. So while they all, yes, have breast cancer, many of their breast cancers are unique. They might have had different treatments. So then you get questions, well, why did she have chemo and I didn't have to? Those kind of things come up. And then the whole emotional impact. Self-esteem issues are brought up. So it covers the whole realm, from physical problems to emotional problems. And for some of the ladies, they can be many, many years out from their diagnosis, and something will occur and it brings it all back to the forefront again, just like it was happening last week. So it varies.
Now, you were talking about self-esteem. Mercy also has a boutique that can kind of help you get through some of those tough times. What's in the boutique?
A little bit of everything and anything that a cancer patient would need to get through their cancer journey. They carry breast forms or breast prostheses for patients who've had mastectomies. They also carry the bras that the prostheses fits in. We also have bathing suits. So if it's someone who wants to go on a cruise after her breast cancer diagnosis and her surgery, and she's had a mastectomy, she can get a bathing suit that her breast prosthesis will fit in and be able to go on her cruise or go to that vacation on the beach. They carry wigs, scarves, head covers. We carry a special skincare line that is specifically formulated for patients that are undergoing chemotherapy and treatments.
So your skin reacts differently when you're under chemo?
It can. So this is free of any kind of preservatives and any of the additives and fragrance and those kind of things that they might find irritating. It doesn't have any of that in it. We carry special sunscreens, which are very important when patients are going through chemotherapy, and it happens to be in the summertime especially. They need to wear a really good sunscreen. And we also carry lymphedema compression garments for your arm. So if they're having problems with lymphedema, we can help with that also.
Which is kind of swelling.
Yes.
Okay. And I gotta ask, why are you so heavily involved with breast cancer? I mean, you do so much at Mercy. You're kind of all over the place.
I am all over the place.
You know, trying to make little clones of yourself to get to all these places. Why are you so involved?
Well, number one, when I first decided to take this job as the nurse navigator, my role at Mercy Medical Center, all of my nursing career has been in the area of women's health. But in days gone by, it was in delivering babies and OB. So I knew when I changed, I wanted to still stay in something that had to do with women's health. So this was kind of one of those transitions that I went into. But also, my son, who's now in his 30s, when he was a high school senior, was diagnosed with testicular cancer. So that threw me on the other side of what I do every day. And so it kind of made me see that anxiety that patients have, waiting for those test results, waiting for the doctor to call you with the pathology report. What do I have to do next? What's going to happen to me? So it put me into a different frame of mind. It gave me a newfound respect for my patients when they were anxious and going through this, because I had been through this with someone I really cared about. So it really changed my perspective on the patient side of it.
So all the work at Mercy has your more than full attention.
Yes, yes. And in addition to that, it made me very passionate about making sure people have the care they need when they need it. So in addition to all of these other things that we have, I also have a grant from Susan G. Komen for the Cure, Northeast Ohio, that covers the cost of mammograms for women who do not have insurance coverage. So for any women out there that have been putting off having their mammogram done, putting off getting that order to get in and get it done, please stop putting it off. We do have an escape hatch, so to speak, to help them get those services. And it doesn't just cover getting them in on the front end and getting that screening mammogram done, because oftentimes a woman will get called back and she's got to have additional imaging done. That grant will also cover the additional imaging. It will cover it if they need an ultrasound. And then once I know if there's a problem, then I can help navigate them into what the next step of this will be. So there are avenues there to get her the help she needs.
Even if she thinks, I can't afford to even look.
Yes, I just need to know who she is so that I can help her do that.
So they just need to give you a call at Mercy.
Yes.
Fantastic. Diane Lofsey, she is the nurse navigator at Mercy Medical Center. Thanks for being on Medical Minutes.
Thank you.
We live in a fast-paced world. Say goodbye to searching books and search engines for all the answers. Now there's iTowns. From finding a place to dine or locating your family doctor, you can also check out the high school game of the week from TV2 Sports. Get your answer with just one click. iTowns has it all.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers and Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome back to DMG TV2's Medical Minutes here on your Time Warner Cable. I'm Jennifer Clark, and this time around we have Heather Fulton with us. Heather is the Tuscarawas County Coordinator for Look Good, Feel Better. What does that mean?
The Look Good, Feel Better program is a program run by the American Cancer Society, who has been generous enough to get Tuscarawas on the map and start a program that we help people going through cancer, chemo, all of that. We give them a day with products and things like that they can come, and we help their physical appearance some.
So we give them a wig, we give them a makeover kind of thing, because when you're going through chemo and radiation, that's one of the major side effects that everybody recognizes, that you do lose your hair.
Yes, yes.
And you feel awful. So what do you do for them?
We do. We have a wig bank that is free unused wigs of many colors and styles that are free to the public. And we also have a class that we run, and I help teach you the different changes that go on with your skin, to maybe it's eyebrows, maybe it's just the change in the pigment of your skin, and I just help you feel more accepted, not standing out like a sore thumb like we all do. So.
And you know firsthand what that feels like, right?
I do. This is my 10-year anniversary for my survival of breast cancer. So this is a big month for me also, and I just want to help anyone get through their challenging times.
What was that like for you when you were going through all the chemo and all the treatments that you needed to do for breast cancer? I mean, did you feel like you just weren't pretty anymore, and now with Look Good, Feel Better, you do make them feel that way? But what was it like for you?
It was tough. Thankfully for my husband and my son and my friends and family, I was able to get through it. A positive attitude definitely helps, and I'm hoping that even with the appearance changes that minor ones that I can help with my guests, that they can feel better about themselves and get through it in a more positive way.
And the Look Good, Feel Better program, there's a once a month, I want to call it a class.
Mm-hmm.
And what do you do that once a month? How long is the class?
We do it once a month. It's usually the first Tuesday of every month from 6 to 8 at Union Hospital. And you call the Cancer Society and sign up ahead of time. So they will have the right color kits. There's all different colors and things like that. It's just a really good time. Something that I know it's one more appointment on your appointment book, but hopefully when you leave you can say, I'm really glad I went.
Right, because it's all about you and feeling better. Mm-hmm. So you want to make that appointment. Mm-hmm. And then, what are the reactions to and it's all women.
It is.
What are their reactions, after they have their makeover?
Of course, everybody's kind of coming in a little hesitant and cautious. And then as the class goes, they communicate with each other and realize, and once they are okay that I've gone through it and I've had all those changes also, then they're much more comfortable and they're so glad they came in the end. And you get to take home your kit, and it is just full of makeup and sometimes polishes and things like that you can use at home too if you like.
And how long has this been going on, this Look Good, Feel Better class?
The class has been going on for quite some time. Tuscarawas County has had some difficulty getting it started and getting it run, so hopefully we'll be able to, it's been improving as the months go by. So once word gets out there and they call the Cancer Society and realize that it's not a bad appointment, it's going to end up being a good appointment, then maybe they will come.
And I think the more people that are aware of it, the more you're going to be full. Your class will be full.
Yes. Yes. So I'm hoping, and maybe there'll be more people that will volunteer and help me and things like that, that we can just grow and just help each other.
So how did you get involved with it?
The previous coordinator decided to step down, and so they were looking for somebody, and a friend of mine at Union Hospital had suggested my name. You have to be a cosmetologist to do it, and so whenever I interviewed, and you go and train and things like that, that's how I got started.
Wow. And what's in it for you? You know, do you also feel that bonding and just helping other people?
Every minute of it. Every minute of it. I feel gratitude that these people allow me into their space and allow me to touch them or to explain things or just into their heart. And I am very, very blessed to meet every single one of them and do what I can.
And as far as breast cancer awareness, do you think it's improving?
Oh, absolutely.
I mean, 10 years as a survivor, that's fantastic. And in those 10 years, how much has awareness changed for you?
It has changed unbelievably. Even the knowledge, you know, the money that is donated, all it is doing is helping, you know, find a cure for this. And it's a great thing.
And there are many different groups. Now, the Look Good, Feel Better is an American Cancer Society based, but there are many groups that want to get that awareness out. Can we ever have too many?
I don't think that we can. I think the more knowledge and the more people we have working on it to find a cure, the better it's going to be.
All right, now if someone wants to sign up for your Look Good, Feel Better class, they just need to contact our local American Cancer Society or Union Hospital.
The local American Cancer Society, which is 1-800-395-LOOK.
Outstanding. Heather Fulton, she is the Tuscarawas County Coordinator of Look Good, Feel Better at Union Hospital in Dover. And you've been watching a special edition of Medical Minutes here on DMG TV2 as we also support Breast Cancer Awareness Month. I'm Jennifer Clark.